Respiratory illness has been a main factor of death in Thailand in recent years. We see both indoor and outdoor pollution contributing to this fact. Bus and car exhaust also play a part. In Thailand, cardiovascular disease greatly affects the population. It contributes to high mortality rates and DALYs. Factors such as smoking, obesity, diet, diabetes, and physical activity all are risk factors. HIV is a leading cause of death in Thailand. The majority of Thailand's HIV cases are caused by limited HIV knowledge and multiple sex partners. Low condom use is a growing concern amongst youth aged 15 to 24. The most at-risk groups are female sex workers, injection drug users, and men who have sex with men. So please use this next time. Hi, I'm Dr. Barbara Winter, and today I would like to discuss with you our 2015 Public Health Initiative for Thailand. Although Thailand has seen HIV rates decrease due to past efforts, new data suggests that the younger population have become more susceptible. So according to UNICEF, we have 70% of reported cases in 15 to 24-year-olds. So we know that affected populations are men who have sex with men, injection drug users, and female sex workers. So this indicates that the Public Health Initiative is needed to re-educate people in these risky situations on the implications of unsafe sex. So the first step of our plan is going to be a foot soldier approach. So we need to get right into the community where this risky behavior happens and kind of re-educate people. So condom use, the importance of safe sex as a whole. So according to AVERT, the past campaigns have not really had a lasting effect on these youth. So our team feels that social media campaign could attract the youth's attention, and this would benefit kind of the growing population. The campaign will include a website. There's often a lot of websites being used for people to find sexual encounters, so we want to have kind of ads on these websites as well. We don't want to shame at all people who are having sex and risky behaviors, even female sex workers. We don't want any shame to be involved. We really just want to do positive outreach, essentially. On the education system, we realize that Thailand doesn't have a really engaging sexual health program for youth, so we want to get into the school systems and educate them from a younger age, and hopefully this education is something that they can carry on through their lives. We have another problem that we're fighting with here, and it's also cardiovascular disease. So our approach to cardiovascular disease is going to be very similar to the one that we have for HIV. So again, this is something where we want to start in the school system. We want to teach children and educators and their parents the importance of exercising and eating healthy. To access the rest of the population on the importance of a healthy heart, we propose a partnership with the government. This will allow us to create kind of a widespread heart healthy campaign. So this, again, will focus on exercise and also extend to smokers. So according to a recent study done by the World Heart Federation, adult populations in these low middle income countries, Thailand included, they're unaware that smoking causes heart disease. So this is where we really need to kind of spread the knowledge that this is indeed a very important factor. And we also understand that behaviors are difficult to change, but we want to logically present the statistics. So it's really just getting the information out there. And then we can disseminate them both publicly in communities and online as respiratory infections. This is because they're due to large-scale environmental factors. As Thailand grows and it gets more and more industrialized, we have to kind of think about deeper the policies that are going to affect. Unfortunately, there isn't a lot of empirical evidence. Although we know in the Western world that pollution does lead to respiratory effects, there isn't enough empirical evidence done in Thailand to actually prove this. So we're hoping to kind of link up with the government and create more actual statistical studies that we can kind of submit to them to say, yes, this is a health problem. So perhaps recommendations to the government could be things like promoting lead-free gasoline, as well as using natural gas while operating vehicles, and decreasing the burning of debris. So again, these are all environmental. So my team and I feel like these three things are the main things that need to be addressed, and through this action plan that we can address it to make Thailand a more healthy place to live and a more prosperous place. So this is our action plan 2015, and please stay tuned for updates.